Hello, everyone, and welcome again to another edition of the Across the Pond podcast with myself, Martin Cullett, International Fellow at the Taxpayers Protection Alliance Consumer Centre, and Lindsay Stroud, who's the Director of the Consumer Centre. And today's guest is Jeffrey Zamora from Costa Rica. He is President of ARDT Ibo America. I think I pronounced that right. And he heads ASOVAPE Costa Rica as well, and is involved with INCO, and has just been published
He's
as one of the authors
crazy.
of
He's got so many
published
titles.
as one. It's just been published as one of the authors of a new study on people who vape who haven't smoked before, which we'll probably talk about later. But welcome, Jeff. Thanks for joining us for this edition of Across the Pond.
Hi guys, no, it's a pleasure to be here, and I'm really grateful that you invite me.
Yeah, well, you're always welcome here. You were welcome in Panama as well. It was great to see you there. Really good to meet you in person again. And it was great how you helped us out, especially with the translation into Spanish for many of those panels. But do you want to just let us know what your thoughts are or were on what happened in Panama, both the WHO conference and the TPA's Good Cop conference that we put on as well?
Well, it's really interesting what happened actually, and we can see, and I don't know if I'm just being too optimistic perhaps, but seeing that the number of countries that actually kind of, at least are curious to see what could be the impact of harm reduction alternatives is actually exciting, how that number is increasing cup to cup to cup. And we're now seeing some other countries that they were not on the radar that actually asking about what could be the impact of these measures as a viable way to help people quit smoking or reduce the harm that they actually, they're experiencing through, the number one cause of preventable death, that is smoking. Currently, not only in Latin America that it was the COP celebrated at, but in the whole world.
Yeah, I think as well, the more of these countries that there are, there's quite a lot in the statements, and rumours that I've heard that many of them stood up to the WHO in the private meetings as well, and said that harm reduction should be considered as a strategy in tobacco control all over the world. So, hopefully, like you said, from COP to COP, this sort of message is increasing, and that should surely, hopefully, embolden other countries to do so. I'm a bit disappointed that one of the countries that didn't stand up for harm reduction was the UK, which I thought was very cowardly. And I know that Maria P, who was with us, she was particularly upset that Canada didn't either. But yeah, hopefully there should be more action on that. What do you think the effect of our Good Cop conference would have been? We got a lot of coverage out of it, media coverage. Do you think that would have been a positive?
Oh, for sure. Actually just expressing the idea, not the idea, but just expressing or seeing that there's another narrative, there is another position regarding this argument, actually to visualize it through articles in the news, to even the live stream because it was huge. What you guys did was huge. Everything it works, it helps in order to visualize or being light to the point that there's another completely different argument from what the FCTC is actually saying. And, I know that unfortunately we're going through a phase in the world where there's a lot of cancellation of voices, right? That when you don't agree with somebody, you try to cancel them. There's a lot of people that works like that. And even though that we have experienced that cancellation when it comes to harm reductions alternatives, not only on tobacco or smoking related, but on some other areas, we experienced it in the past. And it's like the story repeating itself, right? Over and over again, we're trying to make invisible something that is open to the public and publicly seen, generally seen. That is that there's a lot of people that actually are demanding for these alternatives to be properly regulated, accessible, and that actually can bring a big benefit to public health.
I want to segue into that actually. You mentioned cancel culture in a more eloquent way. But we weren't the only conference, the anti-cop conference or tobacco harm reduction conference that was happening in Panama. There was another one with the Latin American, associations. Could you talk a little bit more about that? And especially I know that we experienced it and there was, some pushback from the Panamanian government. Can you tell our viewers a little bit more about what happened at that conference and at ours?
Sure. At the same time that the TPA conference was going, the Good Cop, Bad Cop, right? There was another conference from a Mexican organization that is called Router, where we had, they were a lot of experts, there was a lot of doctors, and people from different governments, including Costa Rica, my own, and Mexico, deputies or regulators, that they are actually, they do have a knowledge about harm reduction alternatives because, even though that, like I said, that is something that appears like new, we know that we have been talking about this for 20 years regarding electronic cigarettes and even longer for snus, right? I think the new kid on the block could be heated tobacco products, right? That they only have been around like 10 years, 12 years perhaps, right? But at this present time, there's a lot of regulators that actually get the point, and they have seen it with some other measures, for example, with drugs, illicit drugs. They have seen that harm reductions work, right? We already had on the conference with UN, the government of Colombia pretty much pushed an initiative that it was actually voted in favor by 60 countries that is proposing harm reduction alternatives to drugs, and that it should be the way to deal with the illicit commercialization of drugs that we have around the world, and that is actually hitting particularly Latin America, right? So that is a conference that it was done. Regulators, there were present regulators, scientists, a lot of consumer advocates around the world that they were present and giving a voice and actually telling about the situation in their countries. We know that in Latin America, there's a push for regulation and as well as another push for prohibition, right? We have countries like Mexico that are trying to ban constitutionally the use of electronic cigarettes, which at least for me is bonkers, right? It's completely crazy, right? And we have seen some other countries that have banned that actually are discussing what is going on with the prohibition and how it's not working on their countries. Like, for example, Brazil, that is one of the largest markets when it comes to e-cigarettes, even though that they're banned, right? And there's talks about it. We today, actually, the day that we're recording this podcast, there was the launch of a new initiative that is called Quit Like Sweden, that is actually by Sueli Castro from KAC. And they're talking a lot about what could actually be the benefits for a country so massive as Brazil to regulate these products, right? There's a lot of talks about what's going on, for example, in Argentina, there's a prohibition as well, and that doesn't make the market disappear at all, actually have grown a lot. And for example, Panama, that we were there, the commercialization's ban as well, right? And I'm pretty sure like that, just like me, you were seeing e-cigarettes pretty much everywhere, right? So at this present time, we know that prohibition doesn't work. We know that it have not worked on anything, right? And at this present time, it was really interesting to have that conference. There was a lot of people, just like in the conference from TPA, showing that there's a general interest regarding this, and that there was a lot of media coverage telling about what these people are saying that are present at the panels. So that was really interesting. So yeah, and you said to talk about what was the other thing? I kind of know that.
The Panamanian police coming in
yeah.
and kind of infiltrating the conferences. I know they didn't really infiltrate ours, but they did come in, and roamed around and scared a lot of the people who aren't from Latin and South America.
Yeah, the curious thing is that they were saying that we were giving brochures, or somebody, not me, but they were someone was giving brochures to the delegates and to people around, kind of incentivizing the use of electronic cigarettes. Whatsoever, there were none given. There was only one that I'm aware of, at least that I'm aware of. There was only one that it was given, and it was to a person in a hotel that asked one of the advocates what they were doing in Panama, and they hand down a brochure from an organization from Colombia that is kind of an information brochure about harm reduction and why e-cigarettes, with the medical reference and all that stuff, right? Why e-cigarettes is a harm reduction alternative for people who smoke. So they throw the police at some of the locations, or at least that's what they say on the media coverage that they had about that incident. And but yeah, they were saying that we were vaping at the hotels, that we were not, right? And so yeah, thank God nothing bad happened whatsoever. Is kind of I don't know, it's kind of sad seeing that intention to shut us down, or I don't know who did it. I don't know what was the intention, of course, but obviously, as people that we actually invite, even the people that are not thinking alike us, right? That they're not, they're not on the same position. We invite them into the conference that we have. We want them to assist, to have a courteous and polite debate about this, to see how we can work out differences and bring public health, forward, right? So seeing this kind of techniques, like I was telling before, that cancel technique, I don't like it personally.
You explained to me when we were over there about this Colombian organization. They're not solely on harm reduction to do with nicotine, are they? They're well respected by the Colombian government and the UN, I seem to remember. Do you want to tell our viewers about that?
That is called Acción Técnica Social. There is a great group. Those are a great group. They're working in harm reduction on different areas. One of the primary ones for them is the harm reduction for people who use drugs, right? And they have drug testing facilities, even at parties, because we cannot, hide the sun with one finger, right? We know that drugs are gonna be used anyway. So one of the measures that they have been using that actually have been proven really effectively is to test the drugs at the locations that they are consumed. So people go to some sort of stand, right, and test the drugs to make sure that there's nothing that it could actually harm them on a more acute way, right, or even death, right? So by analyzing the substance, they can tell them, okay, you can use this drug without pretty much stigmatizing their use. Right? You can use this drug with this substance and this substance, but do not use it with this and this and this and this and this, because it can be counterproductive, or it can actually cause you, serious effects, right? So that knowledge and bringing empowerment to the people about their consumption have helped a lot. And, that's an organization that I respect a lot. What they're doing, they have been fighting for, I don't know how many years, probably more than a decade. And one of the programs that they have is to give information about harm reduction alternatives to smoking. That, like, we know there's a lot of people smoking in pretty much all Latin America in the world. And that's a number that is not going.
And you said they were given a building that was confiscated from the cartels or something. Was that what you were saying?
Yeah. Since they have support from the government, like you were saying, that's an organization that is even recognized by the UN, and they have been involved in international drug conferences, and there's a lot of people that are brilliant there, right? They receive as a donation from the government, so they can have their offices and testing facilities for people on a building that it was confiscated from a drug lord there in Colombia. So it's curiously how, if you open your mind a little bit, the good things that can actually come from things like this, and the government that is in Colombia that is effectively pushing harm reduction measures for people who use drugs, and proactively, and you can see the speech from the president, and how he talks about the importance of harm reductions alternatives for this population. it is really, it's a massive thing for me at least, right? To bring some sort of positive effect to something that it was negative before, right? Like the acquisition of this building because of commercialization of illicit drugs, and actually doing something good with it by allocating an organization that is doing something good to help prevent deaths from the use of drugs.
It's funny that you bring that up because I just did comments for Canada's proposed flavor ban, and that's what with seeing doing some of the research on their tenets of harm reduction, because Canada is another country that, you know, actually the government, you know, funds harm reduction measures, including, especially they've got a very bad drug overdose crisis and everything. And seeing this complete, and Canada's a weird outlier though, because the government does in its tobacco strategy, at least Health Canada does say on their website that e-cigarettes are safer and can help people smoke using a safer product. Why do you think that there is this pushback when it comes to harm reduction? And you're seeing what it's kind of amazing to actually see the stigmatization when it comes to people who use drugs kind of lessening. And maybe it's just because the drug epidemic is so bad and so many people are dying and that, you know, they have to do something, but it's still nice to see that these resources are being given to these, you know, populations. Why are we not seeing the same embrace when it comes to tobacco harm reduction, especially when you're looking at the tobacco epidemic? It's been around way longer than, and globally longer, you know, than the drug epidemic.
And I will think that is the involvement of the people. I know that on the tobacco harm reduction, that is just harm reduction, but is related to tobacco. We have a massive number of people involved in advocacy, right? But whatsoever, the people that are involved in drugs, right, harm reduction, and we can, you know, even see Ethan Naildeman, how, you know, what he have done through the decades, right? They have been able to push knowledge and science to regulators for them to analyze it, because the problem with smoking is that people, regulators, they fear that it's something related to the tobacco industry, right? And unfortunately, some people, you know, at the moment, and even drugs organizations that are working effectively for harm reduction and rigorously, and that they, you know, what they're doing is really, really good. They're afraid to mention tobacco, right, or harm reduction in tobacco, because some people don't get it. Some people just don't want to mix things together, right? But you know, going to something that it was said by a regulator in Spain, which curiously do not support harm reduction for people who smoke. You can only be against harm reduction for two reasons. Either you're evil, or I'm sorry, three reasons. Either you're evil, you're ignorant, or a mixture of the two. So I'm not saying that, you know, some people actually don't get it, and some people want to tell some others how to live their lives, right? And some people still think that the war on drugs is actually doing something good, which is not. And in Latin America, we have seen 1 million people died just because of the war on drugs. And, you know, going back to the president of Colombia, when, you know, quoting one of his speeches, who is gonna, you know, now that they're regulating marijuana and cannabis, right? Who's gonna give us back those people that they were dead because of the prosecution of this, you know, that now is being regulated and commercialized, because we know now that it's not as bad as the president in the 60s of the United States said, right?
Yeah, I mean, I like that knowledge and science that you mentioned there. I like the quote from the guy in Spain as well. I'm going to remember that. But yeah, you mentioned knowledge and science. Do you want to tell us a bit about this study that you published? You're one of the co-authors, and you're studying people who vape who haven't smoked before. What's the purpose of that, and why have you embarked on that?
We know that there's a population that have not been studied pretty much at all, right? And that is the people who vape that have not smoked before, right? We know, because to identify or to know that e-cigarettes are less harmful than smoking, it's easy, right? We know that that is a fact. It's been, we have, I don't know how many studies. If you see Clive Bates recounting of studies each week, you know that it goes from 30 to 50 a week that goes out, right? And there's around, I don't know, like 15, 20,000 studies already, right? So to know that e-cigarettes are less harmful than smoking, it's easy. Whatsoever, to know the absolute effect of vaping is difficult because we need cleaner data, right? We need people that have not been affected by years of smoking, that have not been using any other substance, and that is something that is a cohort that is really difficult to assemble. Now, what we're doing with the Veritas study is looking for people that have not smoked before, that vape frequently, right? And that is globally. We have 6 ambassadors on different regions, right? Pretty much covering the whole world. We have Aman, we have Kurt Yao, we have Juan Jose Sirion Lee, we have Maris Esproga, right? We have a lot of people that are working just to look for people that fit in that criteria, right? That is people who vape frequently, that didn't smoke before, and that they're willing to participate in the study. As we know, and looking up surveys from the United States, from Canada, from the EU, from Australia, the vast majority of people who use these products is smoked before, right? So the looking for the individuals that actually fit the criteria that we're looking for is really, really difficult, right? It's not something that happens overnight. So we have been going on for, I believe, close to a year looking for these people. We have found it. We have published the protocol already. And soon, hopefully, praying on God, that we can actually have the results and the conclusions published really soon, because we already have them, and keep the longitudinal study going to reevaluate these situations and to actually look for some other areas of study within this cohort, because it's groundbreaking. It have not been done before, and we don't have data regarding this population because of the difficulty to assess or to put together this cohort. So I think it is really important. I think that is really valuable what we can actually, the discussion that can be made just by gathering the results or looking at the results. And hopefully, like I said, hope on God, we can have pretty soon the results published on a journal, of course.
Well, that's the journals take forever to get published. Okay, you'll probably have the results, and it'll take 2 years for them to actually get it out, and then that's but that's so cool. I've got a couple of questions. How are you guys recruiting the participants?
Basically, actually we have persons that are going to the vape shops and, asking people when they come in, do you smoke before? Obviously, the response that they're going to get is that the vast majority actually smoke before, but sometimes once in a while, they get somebody that didn't smoke before, right? We're also looking in social media. We're looking into WhatsApp groups. We're looking into Google email lists. We're looking into, for people that are, fitting the criteria, and ask them if they know somebody else that actually is fitting the criteria, right? So in word of mouth, and we're appearing on the press. We're looking, like crazy. Like I said, these guys, the ambassadors, they're doing a terrific job, because it's really difficult. Like I said, they're sitting, sometimes they're just sitting on a vape shop, trying to see who comes in and asking them. So it's a lengthy process, right? It is really difficult to get this cohort to put together, but we're working on it. This present in time, the results that are going to be published are for a cohort, an active cohort fitting this criteria of 500 people, close to 500 people. And we're already working on the longitudinal study that we already have more than 1,000 people.
It's so cool. And also the coolest thing about it, and I'm just beaming with it, like 4 of the people associated are authors of the study. We're good cop experts. So Martin and I picked out some of the best people.
That is sure. Yeah, that is completely right.
Well, we're getting towards the end of the podcast, and we always do this stuff, when I always like to always end out with a positive note and, advice to viewers, advice to, the people that you're representing, and Latin and South America. So, any final thoughts, advice for consumers? What can we expect moving forward? All of that.
Well, as an advice, I don't know if I'm the person to give advices, but you know, and I'm gonna quote Skip on this and be kind. We're dealing with the people that sometimes they're just attached to their beliefs, right? And something that they have been believing or working on for 30, 40 years, and sometimes it's difficult to get it what we're proposing, right? Eventually, like Dr. Alex Wodak said, harm reduction always wins at the end, right? So it's not a matter of if we're gonna see harm reductions alternatives to smoking being done on a major level and encouraged by the WHO at some point. It's just a matter of when, right? So at this present time, I can be what I can suggest to people is be kind when you're addressing others that are thinking differently, because otherwise they could actually go into a defense position, right? And not accepting the argument and just trying to be kind and expressing your sentiments, expressing the evidence that you have and why you think that it should be evaluated and discussed. And after that, be good people and be good persons and try to, learn a little bit about if they're on the advocacy side. Try to learn as much as possible from people like Martin and the whole TPA Ecosphere and Lindsay and Skip and a lot of people that are involved in the harm reduction movement. Try to learn as much as possible. Try to think critically about what's going on and work from there.
Yeah, I've heard Alex Wodak say the same thing. He's very confident, as he said, he's been involved in drugs harm reduction for so long. He said, I've seen it all before. Exactly the same stuff. All of it I've seen before, and I know what happens at the end. So yeah, it's very encouraging when you listen to him speak. Yeah, so I'm glad he's been saying the same to you.
When it comes, for example, on sexual health, right, and how the movement, a woman-liberated movement was the one that brought it forward in the 1900s, right? And when you see what's happening with cannabis, how it have happened, and Ethan and Alex, they were there 50 years ago when it was criminalized, and everything that happened to the moment now that is it's been discussed in many countries to regulate it, and it's been regulated. We just have Germany regulated, right? Like 3 weeks ago, right? And it's been regulated in Uruguay and a lot of places, right? So, and we're seeing this harm reduction guidelines that are being enacted by the UN and the programs about the program about drugs from the UN, the PNUD. No, what do you say in English? PUND. Yeah. Well, the program of the United Nations about drugs, right? And how they're encouraging to use harm reduction alternatives because they're working and nobody ever have died on a needles on a safety injection site, right? And obviously the idea of it is that we want to avoid death on all way possible, right? Because to give them time to people to get better, to deal with their condition and to do a responsible use if they decide to use, right? It should be the number one focus of the measures that we're using. So seeing what happened and what is happening on drugs and is eventually what is going to happen on harm reduction regarding smoking. Pretty much, I do see it like Dr. Wodak. Maybe I'm wrong, or maybe I'm not, but I think that is what's going to happen at the end.
Well, I think that's a good ending point. Don't you, Martin? Do you want to close it off? Do you want me to do it?
You can close it. I just want to say, yeah, it's I always say we're on the side of the angels. I can't see that the world is going to go to, what was the Spanish guy say, to evil people or ignorant people or a combination of the both. I think it will come our way, but yeah. Do
It's
you
a
want to?
great-
You're good at wrapping up, Lindsay.
I can do that. Well, thank you, Jeffrey, for joining us. Always a pleasure to see you. And we're going to see you in Poland, right?
Hopefully, yeah, hope on
Yeah,
God, I'll be
okay.
there for the GFN.
Yeah. Yes, awesome. Well, thank you again for joining us. Thank you, viewers, for joining another episode of Across the Pond, our podcast with Martin and I. Make sure you check out our other episodes. And if you haven't seen our Good Cop coverage for taking place in early February, it's on our YouTube channel. Thank you.